And you're here for your left knee today.
Correct.
So after surgery, before they get you up and walking, they're going to have you order lunch. Pick a sandwich here that looks good. We will get that ordered for you. So you are seeing Dr. DeHaan for left total knee arthroplasty. Initial their signature web, please.
Morning.
Morning.
How are you guys doing?
Good. How are you?
Your surgery should take about an hour and a half. I'll give you a call afterwards when the case is done.
Okay.
And the nurse will contact you probably an hour and a half after that when you can come back and see him.
Okay.
In your words, what are we doing for you today?
Put a retread on my knees, on my left.
Which one? There you go. The left knee.
Yeah.
And we'll mark it right here. I'll see you back there in a little bit. Surgical timeout procedure. Then we're doing his left total knee. Left side is marked. All right, up with tourniquet. Okay, incision. Perfect. Okay, you good? All right, thanks, Heidi. We did it. Hi, Ann. We're all done. Yeah, he did great. So he's in recovery here in a few minutes, and then the nurses will contact you when they're ready for you. Things went well. He had a very good bone quality. He definitely was completely worn out on his cartilage. Had a lot of bone spurs there that we were able to remove. The knee replacement went technically as planned. Good size and fit, good ligament balance. So very happy how it turned out.
Feeling good. I'm Corey. I'm the physical therapist. Nice to meet you. You feel my hands?
Absolutely.
Feels normal?
Yep.
Okay. Can you pull your feet that way for me? Hold them there. Excellent. Yes. And then can you lift this leg up a little? Perfect. Can you lift this leg up? Outstanding. And relax. You're awesome. You're looking great. So all your muscles are kind of waking up. For the next 24 hours, when you go to the bathroom, somebody should go with you. Okay? If you're going to get dizzy and lightheaded, it's going to be at 3 o'clock in the morning going to the bathroom. So make sure you do that. Also today, you ate well. We want you to continue to eat well today. So I tell everybody today, kind of food is your friend. We want you to replenish a little bit. So make sure you get home, have a snack, maybe emphasis on proteins, have a good dinner tonight, kind of build your body back up. And then the other thing is get out of bed very slowly. You're going to do that anyways. But for the next 24 hours, just get up real slow so you don't get dizzy like I'm doing. You'll keep using the walker until your physical therapist tells you you don't need it, okay? It's better to use something and walk well than it is to get rid of something and limp around. All right, so remember, when you go to stand
Stand on the right leg.
stand up on that leg.
So we're going lean forward,
Yep.
right leg.
Yep. And then now go ahead and have weight on that left, and now just good breathing. Don't hold your breath. How you feeling? When you stood up, did you get a little more dizzy or about the same?
No, I didn't.
Okay, perfect. Perfect. And straight ahead. Looking good. Nice work. Straight ahead. Take a couple baby steps so you're up close. There you go. Now you're going to step up with the good leg. You want to step up. Perfect. Up with the good. Very well. And down with the bad. They're going to take you up for x-rays. You are done with me, and you did a fantastic job.
Thank you.
How'd the first walk go? How are you feeling?
I think pretty good.
So here's the x-ray. You can see here's the knee replacement. Here's the tibial component, nicely right down the middle. Femur right here. There's the plastic insert between the two. Side view. Looks great. There's the bar there, but the edge of the femoral component. the tibia, and again, there's that plastic piece, kneecap right there, so things look great. Just as planned. I'll check on them here, and then I'll go downstairs between some patients at a small break and check how they're doing in the recovery, how they're going with physical therapy, and the nurses are able to contact me and let me know about their blood pressure or any different pain medication or different issues going on, just to make sure they're as comfortable as possible.
Yeah.
Good luck downstairs, okay?
There you go.
Yep, thank you.